improve the living conditions of Bariga residents. The authorities of the council, led by Kolade Alabi, deems it necessary to construct a befitting primary health center in each of the council's political wards, as well as the construction of Ladilak Primary School. To intimate the public on this development, the chairman organized a consultative forum to discuss the way forward. Present at the event were newsmen, key stakeholders, residents, executive members, medical personnel, as well as councilors. In his keynote address, the executive chairman Bariga Lcda, Kolade Alabi, said the plan to revamp the Bariga health sector is aimed at raising the standard of living. He noted that all political wards within the locality will have a befitting ultra-modern health center that will be equipped with a state-of-the-art facility.
We are here today to intimate you of our plan to revamp and rebound our healthcare system at the local government. We conceptualize the idea of having at least one PAC per ward. And this is to bring healthcare to the doorstep of our people. You will recall that when I was campaigning and when I was seeking the vote of the people of Bariga, I did make a promise that we are going to bridge the gap between dreams and reality. Some of the things that a lot of people think that is a dream, in our own dictionary, we firmly believe that is a thing that will be a reality. In the last 6 years, we've been able to deliver modestly on our promises during the campaign. We have addressed the issue of the deficit in our infrastructure. Ditto in some of the areas in our educational sector as well. And all the areas that we have not touched, because we believe that it has to be all-rounder. We believe that governance is not all about building bridges, addressing deficits in our infrastructure, building schools and all that. We should also invest in other areas, which I can term as psychological infrastructure, art and culture. We're also going to touch that before we hand over this our pen. We are happy that we have recorded a lot of sources from this health center. Our delivery in that health center per year is an average of 146, which is a very massive record. And the patient is an average of about 500, which is huge. And this health center is built in a particular ward, a political ward called Ward G. So a lot of people will leave their ward because of the equipment that is installed in these CMS health centers, giving us a lot of pressure. There's a lot of wear and tear. So we went back to drawing board, and we now conceptualize this idea that in order to bring health delivery to the doorstep of our people, we have to adopt a system of having primary health care center in all our political wards.
During the interactive session, stakeholders were allowed to make input which centers on the project financing and duration. Speaking with newsmen, the vice chairman, Bariga Lcda, Zainat Kokboni, said the project, when completed, will adequately advance quality healthcare delivery at the grassroots.
As you can see, on behalf of my chairman and who coupled the Hagon president of 774, and I can tell you that a leader must lead by an example. And he is leading, and in the local governments, we run inclusive governance. So my take is, being the head of works and infrastructure, we have plans to give back to the society, and the plans we have is part of dividend of society, democracy. Because if you look at the health factors of each individual in the local government council, you have to feel the pain of the people. And talking about the health sector, the plans we have is just taking medical health facility to the grassroots, because the local government is the closest people to the grassroots and they should have easy access to their health.
There's clear indication that the Kolade Alabi-led administration in Bariga Lcda means well for the people.